Hello again and welcome. You've obviously learned about the labor process and now it's come to the birth part. And remember, it's a journey. We've traveled through most of it and now we've got the last hour. That's what I'm going to talk about today, this session. Hence the position I am in. Because, as I've mentioned before, the media gives us this position for birth. Most people are like this. They push, baby comes out. Even they might be in stirrups while they do it. But you have learned in this whole process of antenatal education here that to optimize a normal birth or a good birth, you need to be mobile. You need to facilitate your own birth the way that works for you best. And in this session, I'm going to talk about just that, how to optimize that, and then tell you about when the baby is born, the challenges you might have during it, and how to best get through this last hour inspired and perhaps enjoying it, and work with the body in the way that is best and quite amazing actually. And remember, this journey, we've talked about this. There's maybe one day you come through this, finally, at some stage, after all this breathing, the meditation, the passing time, so finally, it's that last hour, the pushing hour, the bearing down hour. For the lack of better word, it's the effort when the baby's head is so low that it presses on the nerves that makes you want to poop, really. Remember, going backwards, to get to this stage, to the pushing stage, you optimize your chances by just statistically letting labor start on its own. Being mobile, having good people around you, people who jump in and say, no, you can do it, rather than, oh my God, you remember you're 39 years old and it's a really large baby. You don't need to hear that. Choose the people carefully. Use interventions if you need them, but avoid them if you don't need them. And then wait for the urge to push, because the urge will come. The baby will travel, and I'm saying this for the 10th time, but the baby will travel through your abdomen, lower and lower, until it is just like stools at a place where the body wants to expel it. That's what the pushing stage is. You can do things to assist it. You try and spend as much as you can of the labor at home in the early hour, in the pre-labors. And you allow the emotions that are coming through, you just allow them to come through. You use whatever support that you have in these early stages. Then you're mobile, upright, active. You use the room in the best possible way. Lean onto the bed, stay on the bed, come off the bed, you pee, you eat, you drink. We've covered this all. And then when it comes to this last hour, you're basically looking at a slightly different dynamics than what you've been going through all of this time. There's a little bit more mucus, maybe some blood, there's pressure on your anus, and you really will experience, if the staff notices this, and if the midwives can check you and tell you, oh, you're 10 centimeters dilated, that there's a change in the environment, there's a change in the atmosphere in the room. So instead of getting scared and anxious, oh, why are all the lights coming on? Why are you opening all these packs? Think, that means that finally we've come to the end. We've got maybe around 1 hour left. Maybe just half an hour. And what's happening in your body is that the contractions are still coming every 2 to 4 minutes or 3 to 5 minutes. But the sensation, instead of just breathing through a sort of an ache or a cramping feeling at the bottom of your abdomen, there is the pressure at the backside. And eventually, you start to work with it, you bear down, and most women say, it was such a relief. It ends with a bit of a burning sensation in the perineum. 5, 10 minutes, 15 minutes. By then, usually baby's head is out, nice and slow. Then the shoulder, baby's in your arms. Sounds simple. So just to remind you one more time, you've got, similar to the colon, inside your pelvis, there is a head passing through lower, 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 reaches a certain stage. Like inside the colon, it presses on the backside. Baby's turning, more pressure, and you have to work with it. You're usually not breathing out. You can't help it. The diaphragm, the pressure. It's a bit like if I stick my finger, I can't help this. It's a very automatic response. Same thing, if something's inside you at the very bottom of your colon and in your anus, you contract, and then you actually relax and let go. Especially if you're in the toilet. So what the problem is sometimes when you're in the hospital is that you might be walking around and you're feeling the natural urge might be, I need to go to the toilet. But hey, where is the toilet? There is no toilet. There might just be a bedpan, or you might even have to ask for a bedpan. And there might be people in there. There might be lights, noises. And instead of wanting to get on the bed, spread your legs and go for it with lots of people looking up there, you might feel like, all I want to do is to go to the bathroom on my own. And there is none. So what you need to remember is what you already know. That's the sensation we've been waiting for all this time. So how can you, in this setting, create the best possible way so you can get the baby out? How can you work with this feeling? Find a good position. You might have half an hour, you might have an hour till the baby's out. So if you're on the bed, you happen to be on the bed attached to a monitor perhaps, you can't go anywhere far. If that's a good position, fine, continue. But if you feel what many people feel, by being in this position, essentially on your tailbone, on your lower back, you're not increasing any space in your pelvis, you're decreasing it. So getting up and even off the bed, stand next to the bed, lean onto it, or be mobile, lean forward, take your partner and lean onto him, or sometimes lower yourself down into a squat. Anything that frees the pelvis is often helpful. Then is the privacy. You might need to ask the staff to just to give you a little bit of privacy. You might guess the bedpan in the room, sit on the bedpan and lean forward. And because that's exactly what needs to happen. So in the weird way, you need to push down or bear down, but you can't do that like this. You have to let the pelvis tilt. The baby's going to be born with or without your help. Of course it's going to be with your help. So if you remember, the uterus is continuing to squeeze and press down. The baby meets resistance as it comes down by those squeezes, squeeze, 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 meets resistance and has to turn, has to rotate, right? And because this is a mobile and this is a process ongoing, you might not want to be in the same position the whole way through. At some stages, it might feel like it's not progressing, or it's not good, it doesn't feel right. Or then it's best to take whatever you're doing and change it, swap it completely. So perhaps you're on the bed, but in this position here. or you're lying on the bed and you're on your side. Anything that makes you feel this urge and work with the urge naturally, because then you're going to do the right thing. I'm going to look completely ridiculous if I try and mimic what you're supposed to do, but it will look like a dog pooping on the grass. It'll be like this, one way or another, either on the bed, on your knees, on the bed, on your back, or on the floor. It's always going to be a curved thing. It's going to be a toilet thing. So if you're a man, it's exactly what you do in the toilet. Go in, close the door, drop the pants. So if you want to practice, that's what you do. Now, if you haven't had any pain relief at this point, it's not going to help you. If you're fearing or worrying about this, that this will be painful, this stage is about an urge. It's not about time passing so much or calming down. It's just focus inwards, feel what's going on. There's a very strong urge, and as soon as you work with it, it's actually a relief. If you have an epidural at this stage, you better let them wear it off. And if you have gas still, put it down, stop using it. Get your head in the right place, get on with it. You've got half an hour to go. A lot of people are worried about this stage, that it's going to be painful, that they will tear, and that they will poop. And the simple answer is, well, if you're worried about this, go to the toilet. If there is no toilet, use the bedpan. Ask people to leave. Take 10 minutes, sit on it. And if nothing comes out, there's probably nothing there. The urge that you're feeling is the baby's head. And then it's actually quite a relief. You've tried it on the toilet and you know what to do. And that's what you continue with on the bed or close to the bed. In another session, I'm going to explain to you exactly what positions are available to you. But in short, let's work with 3. Preferred by hospital staff. Back of the bed is up, you're on your back, and you're either with feet like this or in stirrups. It goes without saying, I'm not going to emphasize or advocate this position. I really don't believe in it, but sometimes it works quite okay. It's worth trying, but to stay in it is probably not going to give you the best result. Lying on your side, can't fully do it here, but holding your upper leg will sometimes do a good job, help the pelvis as well. And then the third one that I just showed before, where you're on your knees, on the bed, hugging the back, tilting your pelvis. We will cover this another time, but think of these 3 to begin with as possible options that are not going to be too challenging for the staff to deal with. And then the last stage of this, when you've been pushing for sometimes 10-15 minutes, sometimes for half an hour to an hour, eventually the head starts to be visible. And the perineum, the area from the vagina down to the anus, it's a thick, feels a bit like this, it's thick and muscular almost, because you've got the pelvic floor muscles there. But when the head is slowly moving down, and the contractions and the hormones that are working all together in a cycle, when it's all been functioning for a while, this same area, it thins out and becomes paper thin. So usually, when you have this crowning, as it's called, there is, especially with the first baby, a slight tear in the skin tissue. And it feels like burning. It's not a comfortable feeling, but it's for a very short time, and most women can take it fine. A little bit of counter pressure from the midwife or the doctor may help, and using upright position has shown to be more comfortable. 10-15 years ago, there used to be a routine practice of cutting this area to increase the size for the head to come out. But this has been discontinued as a routine practice because it gives you more risk of a larger trauma. And I wouldn't necessarily dwell on the crowning or think about it much, but it is a question that we get often. And really, in the big scheme of things, it's usually about 2 to 5 minutes out of the whole process. So it's manageable. And then as soon as the head slowly slides out, usually the baby looking down, so when the head comes out, you've usually got about a minute or two, then the baby rotates, and then the shoulders are slowly born. And typically, the baby, if you're in this position, is just given straight away to mom. There's no need to rush. It can be quiet. It's a special moment, and you can cut the cord, or the partner can cut the cord within the next maybe 5 minutes or so, but there's no rush to do it immediately, like we used to do. Have the cord stop pulsating is something that is perhaps a slightly new concept, but it's worth doing, letting the placenta drain all the blood to the baby rather than cut the cord before. I find it's worth thinking about that the baby has been inside for all these months now, and when it comes out, that you want to try and create the best environment possible. So keeping it calm, keeping it quiet, keeping the lights off, asking people to speak in a low voice, being able to move like that and being mobile within this stage, it will all help you and help the baby to make it easier. It's also worth thinking about it. That feeling, that urge of needing to push or pull is a very private feeling, always in our lives. So we'd normally go into a private room and close the door. So if you can find a way in the hospital to maintain that privacy somewhat, then usually you also have an easier way to connect with the feeling and work with it efficiently. Thank you.